You know, your brain is by far the most energy-hungry organ in your entire body. It's working around the clock, 24/7, even when you're fast asleep. So how does it get that non-stop, completely uninterrupted supply of blood it needs to keep, well, everything running? That's exactly what we're going to map out today. We are going to trace the whole intricate network, from the major arteries leaving the heart all the way to the tiniest capillaries inside your spinal cord.
To really wrap your head around the scale of this, let's just start with a couple of mind-blowing numbers. First off, even when you're just sitting there, doing nothing, a full 15% of all the blood your heart pumps out is sent directly to your brain. That is an incredible amount of traffic for an organ that only makes up about 2% of your body weight.
And it's not just the sheer volume of blood either. The brain is also a massive oxygen hog. It consumes 25%, a full quarter of all the oxygen you breathe in. These numbers make one thing absolutely crystal clear. The blood supply to our central nervous system isn't just important, it is mission critical. Any interruption, even for a few seconds, can be catastrophic.
Okay, let's dive right in. Here's our roadmap. We're going to start with the two major arterial highways that deliver blood to the brain, the anterior and posterior systems. Then we'll zoom in on the specific arteries that supply different territories, see how the veins collect all that blood, and we'll finish up with the very unique blood supply of the spinal cord itself.
So the entire arterial supply to the brain can really be simplified into two main systems. The best way to think about them is as two pairs of major highways, both starting from those huge vessels near the heart. We've got the anterior circulation and the posterior circulation.
And everything starts right here at the arch of the aorta. Now, if you look at this diagram, you'll see a really key difference between the right and left sides. See, on the right, there's this single large vessel, the brachiocephalic artery, that branches off first. Then it splits into the right common carotid and the right subclavian arteries. But look at the left side. Those two arteries, the left common carotid and the left subclavian, they come directly off the aortic arch. That asymmetry is a really important anatomical point.
And this table here neatly divides the labor between our two highway systems. The anterior circulation, which is also called the carotid system, is fed by the internal carotid arteries. And I'm really stressing internal here because there's also an external carotid artery, but its job is to supply all the stuff outside the skull, like your face and scalp. We are focused on what gets inside. So this internal carotid system supplies most of the forebrain, with one notable exception, the occipital lobe. That part is handled by the posterior, or vertebrobasilar system, which is fed by the vertebral arteries and takes care of the occipital lobe, the brainstem, and the cerebellum.
All right, let's zoom in on that anterior system. We're going to follow the main vessel here, the internal carotid artery, or ICA, as it makes its way from the neck right up into the base of the skull.
So, the ICA's journey is split into four distinct parts. Let's walk through them. First is the cervical segment. This runs through the neck, and what's really unique here is that it gives off 0 branches, none at all. Next, once it enters a canal in the skull, we have the petrous segment. This one gives off the caroticotympanic artery to the middle ear, and sometimes an inconsistent pterygoid canal artery. Third, we have the crucial cavernous segment. This part gives off several key branches. One to the trigeminal nerve ganglion, the anterior meningeal artery to the brain's covering, the critical ophthalmic artery which supplies the eye and everything else in the orbital cavity, and the hypophyseal arteries which form the portal system for the posterior pituitary gland. And finally, we get to the cerebral segment. This is where the ICA's journey ends, by splitting into its terminal branches that actually supply the brain: the anterior cerebral, the middle cerebral, the posterior communicating, and the anterior choroidal arteries.
Okay, now for our second major highway, the posterior circulation. This whole system is defined by the vertebral arteries, and they take this truly remarkable, well-protected path up through the bones of your cervical spine to get to the brain. Let's trace this path step by step. So first, they branch off from the subclavian arteries up in the chest. Second, they travel straight up the neck, passing through these little bony tunnels in the vertebrae called the transverse foramen, all the way from C6 up to C1. Third, they take a little detour, moving outward at the C2 vertebra before going back up to C1. Fourth, they curve backwards, pass underneath a ligament, and then enter the skull through the foramen magnum. That's that big opening at the base of your skull. And finally, step 5. Once they're inside the skull, the two vertebral arteries run forward and actually merge together at the base of the pons to form one single powerful basilar artery. Now, before we see how these two huge highway systems connect to each other, we need to define a really important term: anastomosis.
Simply put, an anastomosis is just a cross-connection. In our circulatory system, it's a link between two blood vessels. You can think of it as a detour or maybe a backup route. And that brings us to probably the most famous anastomosis in the entire human body, the circle of Willis. Think of it like a big arterial roundabout at the base of your brain. It's what connects the two systems we've just talked about, the anterior carotid system and the posterior vertebrobasilar system. The whole point here is redundancy. It's a critical safety feature that lets blood get rerouted if one of the major arteries feeding the brain gets blocked. But, and this is a really, really important point, this circle can look very different from person to person. These anatomical variations are incredibly common.
So we've seen the major supply lines. Now let's zoom in on the final distribution network, the cerebral arteries that go to specific territories of the brain. After that, we'll take a look at the venous system that collects all the deoxygenated blood for its trip back to the heart. All right, first up, the anterior cerebral artery, or ACA. It's divided into a few segments, and its cortical branches supply the structures that run right down the midline of the brain, like the olfactory cortex and the corpus callosum. But here's the most important clinical point to remember. The ACA supplies the strip of cortex called the paracentral lobule, and that part controls motor function and sensation for your lower limbs. So, if there's a problem with this artery, it's going to specifically affect the legs and feet. Its deep branches also supply parts of the caudate nucleus and the internal capsule. Next is the biggest one, the middle cerebral artery, or MCA. Its cortical supply is massive. It covers most of the lateral surface of the brain. Functionally, this means it supplies the motor and somatosensory cortices for the entire body, with one big exception, the lower limb. And we just learned that's covered by the ACA. The MCA also supplies the auditory zone and the insula. Deep inside, its branches, called the lenticulostriate arteries, supply really critical structures like the lentiform nucleus and parts of the caudate. This cross-section gives us the perfect visual summary of these territories. You can see these distinct color-coded areas so clearly. That blue area running right down the middle, that's the ACA's turf. The huge yellow and orange areas covering the side, that all belongs to the MCA. And those pink and red areas in the back and on the bottom, that's supplied by the PCA, which we're going to cover right now. Okay, now for the posterior circulation branches. First, the posterior cerebral artery, or PCA. This one handles the occipital cortex, our vision center, plus the thalamus and other deep structures. Then, coming off the basilar and vertebral arteries, are several arteries that supply the cerebellum and brainstem. You have the superior cerebellar artery, the anterior inferior cerebellar artery, or AICA, and the posterior inferior cerebellar artery, or PICA. Now listen closely. Clinically speaking, PICA and AICA, along with those small penetrating branches of the basilar artery, are very, very common sites for blockages, occlusions, which can cause incredibly severe neurological problems. So we've mapped out the entire supply network. Now let's look at the drainage system that gets the blood out. Before we dive into the specific veins, it's really helpful to just quickly contrast them with arteries. Arteries have a much more predictable location, whereas veins can be a lot more variable. Arteries, of course, carry blood away from the heart and have thick muscular walls. Veins carry blood towards the heart and have thinner walls with much larger internal spaces, or lumens. The brain's venous drainage basically has two main parts. You've got superficial veins on the surface of the cortex, and you've got deep veins that drain all the structures hidden inside. But here's the thing. Both of these systems ultimately empty into these large channels that are actually embedded in the brain's tough outer covering. These are called the dural venous sinuses. From there, all of that blood, and the cerebrospinal fluid too, it all collects into one main vessel, the internal jugular vein. And just like we saw with the carotid arteries, remember, internal means it's draining the brain itself, while the external jugular vein handles the outside of the skull. All right, for our final section, we're going to turn our attention away from the brain and look down at the spinal cord. It has its own very unique and, in some ways, much more vulnerable system of blood supply. The spinal cord is supplied by three main arteries that run lengthwise, and all of them actually branch off the vertebral arteries we saw way earlier. There is a single anterior spinal artery that runs right down the front, and it supplies the anterior 2/3 of the cord. Then there are two posterior spinal arteries that supply the back, or dorsal 1/3. This main supply is then reinforced at different levels by smaller segmental arteries that come into the spinal canal along with the nerve roots. This diagram just perfectly illustrates that division of labor. You can see that big territory shaded in red. That's the anterior 2/3 of the cord, all supplied by that one single anterior spinal artery. The unshaded posterior one-third is supplied by those two paired posterior spinal arteries. This clear split is incredibly important in a clinical setting because a blockage in that single anterior artery can have really widespread consequences. On the venous side, blood from the cord drains into this complex network called the internal vertebral venous plexus, which sits in the epidural space. Now, this brings us to a crucial clinical point. The blood supply to the cord isn't perfectly uniform all the way down. There are certain areas, sometimes called watershed zones, where that reinforcing blood supply is a bit weaker. This makes them more vulnerable to damage if blood flow gets compromised. The key areas you have to remember are the upper thoracic region from T1 to T4 and the ventral or front part of the L1 vertebra. So we've journeyed all the way from the aorta to the tiny capillaries of the spinal cord and back again. This brings us to one final, thought-provoking question. Considering the brain's total reliance on constant blood flow from these two big systems, what are the real clinical advantages and disadvantages of having a backup design like the Circle of Willis, especially when we know it can be so different from person to person? It's a question that really highlights the beautiful, but sometimes very fragile complexity of our own anatomy.